positively, living positive, living positively, living positive.
Welcome back to part B of the Introduction to HIV and AIDS of the Treatment Literacy series. In part A, we learned about the natural history of HIV/AIDS and the epidemic. We also looked at the life cycle of the HIV virus. In this program, we're going to learn how the human body works and discover the different stages of HIV illness, from being infected to developing AIDS. Let's go to Vuyiseka and the workshop.
My name is Vuyiseka Dubula. I'm going to do an introduction about the body systems and the cells, and then we're going to do a brief introduction of the HIV stages. First of all, what we need to understand is our bodies are made up of millions of cells. Because we have so many cells in our bodies, and those cells are helping us in fighting infections, they are helping us in transporting blood, in oxygen, so we need those cells. But to imagine the millions that I'm talking about is to imagine a sea. A sea is made up of water and the sand. If you take the sand and you take one particle of the sand, that would represent one cell in your body. So you check all the million particles of the sand in the sea, that means you have so many. We can't count them, but they are there, and we cannot survive without them.
What our body is made of. Our bodies are made up of millions of cells. There are different kinds of cells, each performing different functions. Cells with the same function are grouped together in organs. For example, the liver. Organs working together to perform the same function are grouped together in body systems. For example, the heart in the circulatory system.
All cells in our bodies are grouped together as different organs, and the organs work together as different systems. The digestive system helps us eat and digest food. The respiratory system allows us to breathe and get oxygen to different parts of our body. The immune system defends our body from attack by germs. Let's find out about the different systems of the body.
Organs don't work on their own. They need the participation of the other organ to work. If the other organ doesn't work, then there will be a disturbance in the system. The liver is part of the digestive system. The kidney is not part of the digestive system. It's part of the excretory. It takes out water that is not needed. What are the others? The intestine, big intestine and small intestines, the stomach, the food pipe that we talked about. If it's blocked, there won't be any food coming in. The pancreas. But the idea is to get that you need all body organs to work in order to have a system, a complete system that works.
The digestive system is our guts, which start from our mouths and go down through the food pipe to the stomach and intestines to our anuses. The digestive system is supported by the secretory organs, the pancreas and liver.
Why do we need lungs? What is the importance of the lungs, or what is the function of the lung?
Okay, the function of the lung is to breathe in and out the oxygenated air.
Okay, that's true. We need the lungs because the air that we breathe in, which is oxygen, we need it. And it also helps us to bring out the bad air that we don't need, which is carbon dioxide. The lungs belongs to the respiratory system. To respirate is to breathe. So that means it helps us in breathing. If you have an infection of the lung, the air tubes will be blocked by the viruses or the bacteria that affects the lungs, and then you can't breathe properly. And the air can't go in and out as it should.
The respiratory system consists of our lungs, the passages leading to the lungs called the bronchi, the diaphragm, which moves our lungs, and those parts of our throats which enable us to breathe and speak. The respiratory system carries oxygen from the air into our bloodstream.
Can one person tell us what is the function of the heart?
The function of the heart is to pump the blood to all the parts of the body.
The function of the heart is to pump. It's not a place of love where people would say, from the bottom of my heart. No. It's a place where blood is pumped to all parts of our bodies. Heart, because it pumps the blood, so it belongs to the circulatory system. Some bacteria can block the blood vessel, and then you can have clotting. But sometimes they don't only block them, they cause the blood vessel to burst. And then when it's bursting, then the area where the blood vessels was going to, it won't get enough blood or enough oxygen.
The circulatory system includes our heart, our blood, and our blood vessels, that is, veins and arteries. The heart pumps fresh blood filled with oxygen from our lungs to all parts of the body through our arteries and veins, from which it returns to the heart and goes around again. The basic function of the immune system is to recognize what is part of our body and what is not part of our body, and to fight off the germs that are not part of our body. The immune system consists of our skin and the mucous membrane of our gut and airways, as well as specialized white blood cells which fight infections. Here, we are looking at the very tiny cells in our blood responding to infection by even tinier pneumonia bacteria. The amazing thing about part of our immune system, called the adaptive immune system, is that it can learn to recognize certain kinds of invaders and become better and better at fighting them.
Here, the macrophage presents a piece of the pneumonia bacteria to the CD4 cell. The CD4 cell will now be able to recognize the pneumonia and call other immune cells to help destroy the enemy.
Our CD4 cells are part of this adaptive immune system. When viruses or bacteria or other germs try to invade our bodies, it is our CD4 cells that are key to helping the other immune cells respond effectively. It is often said that the CD4 cell is the general of the immune system. It is because HIV attacks this important part of our immune system directly and not other less important parts of the body that HIV is such a deadly disease. Most of the opportunistic infections affecting people with HIV are not caused by HIV itself. They are caused by other germs which take advantage of our weakened immune system. They are called opportunistic because HIV weakens our immune system, creating an opportunity, and they take advantage.
Organs and body systems. Organs work together in systems. For example, the heart and veins form the circulatory system. Our systems include the circulatory, respiratory, digestive, and immune system. The immune system protects us from infections and from cancer. The immune system consists of the skin, lymph nodes, and immune cells, for example, the CD4 cells. Opportunistic infections attack when the immune system is weak.
So, what happens when our bodies are infected with HIV? Our bodies have never seen HIV before, and they do not know how to fight it. The virus copies itself very fast, and the viral load, that is the number of copies of the virus in our body, increases very fast. Once we have been infected, there are 4 stages of HIV infection. These stages are defined by the kinds of illnesses we are getting. These stages were defined by the World Health Organization. Now, back to Vuyiseka and the workshop.
Where do we come to the point of knowing which stage are you in? It is done in a way that you would understand that a stage is made by the opportunistic infections that you get in that stage. And there's an organization that came up with these stages. It's called the World Health Organization. Because of the progression of HIV, then you move from one stage to another stage, and that is staged because of the illnesses that you have.
The green line shows the number of viruses in your blood. The red line shows the number of CD4 cells in your blood. I am going to explain what happens if HIV is not treated with ARVs. In the first few weeks after infection, the amount of HIV in your blood will become very high and your CD4 count will drop suddenly. In some people, but not in all, this will show itself as a flu-like illness. As the viral load rises, the CD4 cells kick in and act against the virus to bring the virus under control. Stage 1 is the asymptomatic stage. That means that although you have HIV and can pass it on to others, you don't get any HIV illness. This can go on for many years. However, it does increase slowly. At a certain point, after about 6 years, you may enter stage 2, where opportunistic infections start to occur because of lowered immunity. The virus now increases more rapidly and the CD4 count declines. When the CD4 count gets below 200 per milliliter of blood, we then talk of the 8th stage, where very serious illnesses occur. At any point of HIV infection, you are infectious to others.
Stages of HIV. HIV is divided into 4 stages. The stages refer to the progression of HIV infection if it is not treated with ARVs. They go from the point of infection up to the late stage AIDS. This process can take between 5 and 10 years, depending on environmental factors and access to healthcare. The stages are defined according to the infections that occur as your immune system or CD4 count drops after HIV infection.
During stage 1, we have no symptoms apart from frequently swollen lymph glands.
At some point in your first stage, your asymptomatic state, that is where you don't have symptoms, but you do have HIV. Why? Because now the immune system is starting to fight this infection. But there's a point where your immune system, because the virus is attacking your CD4 cells, the immune system in your first stage goes down, and then the viral load starts picking up. It's going up again.
As we have seen, HIV does not reveal itself after infection, though some people may experience a flu-like illness with swollen lymph nodes and a skin rash. New research is showing that during the acute phase, in the first few weeks after infection, you may be especially infectious to others because of the high viral load. Some researchers believe that this is when many new HIV infections occur. The number of years during which you can remain in stage 1 and not experience any opportunistic infections is affected by factors like access to quality health care, good nutrition, not smoking, taking drugs or drinking too much, and the environment you live in.
Stage 1. In stage 1, there are sometimes minor symptoms, for example, swollen lymph nodes.
So in stage 2, that is where you start getting symptoms. Those symptoms are the opportunistic infections that I'm talking about, where you would find that a person is starting to have shingles, a person is starting to have dry skin, or you can have also bronchitis or fever, or starting to lose weight. Anyone who think that they have stage 2, one by one, go and stick your illness there.
Oh, we've got a skin rash. A skin rash is when you get small pimples around your skin.
Epilepsy, we know that we can find it at the mouth and there by the parts of the man and the woman.
I have got sinusitis on the ear, and it is regarded on stage 2.
This one, we found it in the lungs when it cannot work very well to breathe, so we found it there.
During stage 2, we get infections like herpes zoster or shingles, various skin problems, and mouth ulcers. You don't have to be HIV positive to get herpes. Anyone who hasn't been exposed to the virus can get them.
In stage 2, there could be the following symptoms: cold sores, skin rash, shingles, herpes simplex, lung infection.
Then you have stage 3. Stage 3, it's when you're starting getting sick. But you can prevent getting to stage 3 and stage 4 by making sure that you are prolonging your life from stage 1 to stage 2. You stay in those stages for a long time. How can you do that? By eating healthy, by making sure that if you have shingles, you treat them early with the proper medication so that you don't progress easily to stage 3. Any illnesses for stage 3?
I've got a peripheral neuropathy, which is a side effect of a TB treatment. It might be a side effect of a D40 in ARVs.
I've got bacterial pneumonia and TB of the lungs that are related to stage 3. The TB of the lungs is caused by the bacteria called mycobacteria, and it is treated by the Rifampicin. And the bacterial pneumonia, I've got antibiotics, that is amoxicillin.
Remember, I said thrush. If you don't get it on stage 2, then maybe you can get it on stage 3. It's not automatically that you will get it there. Some people who are on stage 3 can get the oral thrush because their immune system is weak. Peripheral neuropathy, you can get it at any stage. It is caused by HIV itself. It can be caused also by the other treatments that you are taking, for example, TB treatment or HIV treatments. But HIV itself can cause peripheral neuropathy.
It is during stage 3 that you start getting serious OIs like oral thrush, a fungal infection of the mouth. Stage 3 illnesses also include TB of the lungs or pulmonary TB, chronic diarrhea, weight loss, and recurrent fevers.
In stage 3, there could be the following symptoms: oral thrush, meningitis, loss of weight, colds, diarrhea, TB of the lungs.
and then you can progress now to the late stage that is called AIDS, where you'll have all the opportunistic infections at one time. That would be TB outside the lungs, which is called disseminated TB. You can start having HIV dementia. You can start having cryptococcal meningitis. Can we move to stage 4?
Okay, here I've got cryptococcal meningitis. Cryptococcal meningitis is a stage 4 related it's a stage 4 HIV-related illnesses, which is caused by the fungus called Cryptococcus niformans. We normally find this kind of fungus from the soil, because when we are breathing in, we breathe in some dust, then the Cryptococcus niformans is there in that dust. As I said, that cryptococcal meningitis is normally found in the brain and the spine. Then you might have stiff neck as a symptom of the cryptococcal meningitis. Cryptococcal meningitis is being treated by the antifungal medication, which is called fluconazole.
This is PCP pneumonia. In full, it's pneumocystis carinii pneumonia, which is classified as stage 4. It is the pneumonia that is caused by a fungus, and it can be treated by a high doses of ecotrimoxazole or Bactrim, sometimes in a hospital through a drip. Then after that, you can take Bactrim as a prevention of pneumonia not coming back.
Here I've got disseminated thrush, and it is found in the system. The reason why it is called the disseminated, it is because that it is in your system. So that's why it is called dissemination. And it is caused by candida, and it is treated by fluconazole.
And put sarcoma here. TB outside the lungs, it means the TBs of the brain, TB of the spine, TB of your stomach. Those TBs are common at stage 4.
Stage 4 is very serious. When we get stage 4 infections like thrush in the throat, this means we have AIDS and we need to start ARVs. How long does it take for us to get to stage 4? This depends on a large number of factors, depending on our general health, our living circumstances, what strain of HIV we have been infected with, and how many times we have been infected. It can be anywhere between 5 and 10 years.
In stage 4, the following symptoms can occur: oral thrush, losing weight drastically, PCP pneumonia, TB, Kaposi sarcoma or skin cancer, toxoplasmosis, cryptococcal meningitis. ARV treatment must be started regardless of CD4 count. Progression to AIDS depends on access to healthcare, eating healthily and having enough food every day, drugs, smoking and alcohol abuse, reinfection with HIV, the strain of HIV you have been infected with, early and effective treatment of all opportunistic infections.
Environmental factors are also very important. Do we have good, clean water? Do we have an income? Do we have access to medical care, to a clinic? If we do have a clinic nearby, does it have all the medicines it should? If it has all the medicines, do the healthcare workers know how to use them properly?
Environmental factors in HIV includes access to clean water, stable income to provide food and housing, access to clinics, access to medication, access to correct treatment.
We are now finished with the introduction to HIV/AIDS. This program is a foundation for the rest of the series, so it's quite important you understand it before going on. Ask lots of questions, discuss them, and use the workshop notes to get further information. Let's carry on learning together and taking care of our own health and each other. Till next time, goodbye.